with Carrie Tracy. Carrie works with us at CSS, and one of her specialties is hospital financial assistance. She actually just finished a really big report. It's really interesting. We should definitely get copies to all of you so you can check it out. That's why we're always bothering you for stories, too, because Carrie's really interested in what the hospitals are doing right, what the hospitals are doing wrong. And so we wanted to give everyone a refresher on what are hospitals supposed to do and what are hospitals not allowed to do. And I really want you guys to utilize this time with Carrie to ask your really tough questions, because I know charity care can be super confusing. So we're going to run through a presentation, and then Carrie's going to show you guys the awesome tool that's on our website where you can look up charity care policies. It's really cool. So I am going to turn it over to Carrie.
Hi, everybody. I'm Carrie, as Ashley said, and yes, hospital financial assistance is my passion. I've been spending way too much time with it. So I'm gonna force you guys to live in my world for a couple minutes. So hospital financial assistance. So we're going to talk about why this is important. We're going to talk about where the money comes from and what hospitals get it. We're going to talk about how you help somebody apply for it, what the rules are, and what hospitals are allowed to do when it comes to debt collection. So why do we even care about hospital financial assistance? We care because it's one of the few programs that's out there that's available to people who are uninsured. So we know that 2.6 million uninsured people in New York State, 14% of the state is uninsured. And after 2014, we're going to bring that down with affordable health care, or the Affordable Care Act, federal health care reform. We're going to bring that down to 1.4 to 1.8 million uninsured. But at least 400,000 undocumented people will be uninsured after that, because there's nothing in health care reform for the undocumented. So we know that there are a lot of people in New York State who are uninsured. That's getting worse with the recession. And 37%, I think, of clients last year were uninsured. So we know that we've got a lot of people who are coming to us for help getting care. So hospitals often charge uninsured patients these inflated self-pay rates. So if you go in by yourself and you're uninsured and you're trying to get care, you don't get to negotiate. You don't get to bring 100 million people in with you to negotiate for a better rate like Medicare does or Medicaid. And so they charge people who walk in on their own much higher rates. And we know that when people don't get the financial assistance that they need, it can cause permanent problems for their family's finances, for their budget. So 62% of all bankruptcies were linked to medical debt in 2007. And when people have medical debt, they forego care. They don't go to the doctor when they need to, or the doctor tells them they need a test or treatment or prescription, and they avoid it. And that leads to worse outcomes for people. So they're losing their health and their financial stability. So New York State has a great solution. We give out $1.2 billion every year in state and federal money, and that money goes to hospitals so that they can take care of people who are uninsured. And that money comes from hospital and insurance company surcharges. When you go to the hospital, you or your insurance company pays like 10% tax on your care to pay for this fund. And then local governments put in some money, and the federal government matches it with Medicaid money. So this money's been there for a long time, but advocates like you noticed that people weren't getting the care that they needed. So we fought for some reforms, and in 2006, a financial assistance law came in that said that it was time for hospitals to get serious about this. In the past, they didn't have formal policies. People would walk in, and they'd get crazy information. And so starting 2006, every hospital that takes this funding has to have a formal financial assistance policy. They have to have an application and a summary. They have to give discounts to low-income people who are uninsured. They have to follow very strict rules for the application, and they have to use fair collections procedures. So what does this law say? Who qualifies for financial assistance? All right. So you have to be uninsured or uninsured for that benefit. So say you have really bad insurance and you have an annual limit, which will go away with the Affordable Care Act, but for now people still have annual limits. Or maybe your insurance policy says that it covers medical but not mental health, or they don't cover what's that? Bone marrow transplants. They have some sort of carve-out that they don't qualify. And you're unable to pay for services, and you meet the income limit. So your limit can be the hospital's limit can be no lower than 300% of the federal poverty level. Hospitals can go above that, but they have to at least provide financial assistance for people up to 300% of the federal poverty level. And you have to live within the hospital's geographic service area, although there are some exceptions. So in general, if it's emergency care, you have to live somewhere in New York State. And if it's non-emergency care, you have to live in the county that the hospital is located in or an adjacent county. And New York City has even better rules for that. So the one exciting thing about this program is that there are no immigration status requirements. We've heard of people being told that they don't qualify for this because they're undocumented or they have the wrong immigration status. Not true. There are no immigration status requirements. So that's why this is going to continue to be a really important program for undocumented folks and immigrants who don't qualify for public programs. So some hospitals have permission to consider the assets of very low-income patients. If your income is below 150%, they can look at your assets. Hospitals get this wrong. They try to look at everybody's assets. So that's something that we're watching out for, and you should watch out for if a hospital is giving your client a hard time about their assets. They might not even have permission to look at them, so check with us about that. So if you qualify for financial assistance, the hospital has to offer you a sliding scale discount. So if you're below 100% of poverty, you just get nominal charges. And you can see at the bottom of the slide, the state said what a nominal charge is. If you're an inpatient, you only have to pay 150% for every discharge. If you're going in for ER or clinic visits as an adult, it's $15. And kids, pediatric and clinic visits are free. So there are some limits. So if you're below 100% of poverty, you pay very, very low charges. Above 100% of poverty and between 100 and 300, there's a sliding scale. So the very most that you could ever be asked to pay is a standardized charge. And that means the highest amount that the hospital is paying either to Medicaid or Medicare or their highest volume public or private insurance, commercial insurance company. So they look at those three charges, they pick one, and they can't charge you more than they pay that payer. So that gives people a little more bargaining power. They're not going in by themselves. They're walking in with all the people in that commercial plan or something. So that's the most that you can pay if you're up to 300% of poverty. And between that and 100%, the hospital can set up a sliding scale, so you pay some percentage of that set charge. So beyond saying how much you have to pay, the law puts together some rules about how the hospital has to look at your application. So they have to have a process, and the law says not unduly burdensome. It has to be something that people can do. And the guidance from the state is that it should be really unbelievably simple, and hospitals aren't doing that. So somewhere between unbelievably simple and not impossible is where they're supposed to be, and some of them are really at impossible. They have to include information about financial assistance on every bill that they send out and every statement. And they have to help patients with the application once they get it. They're supposed to tell every patient about the existence of the policy, and certainly anybody who says that they're uninsured should hear about it. They have to make it available in the primary languages that are served by the hospital. They have to have a minimum timeline. If you turn an application, they have a certain amount of time to get back to you. You have a certain amount of time to submit it, and that's all set out in the rules. They have to have an appeals process. If they deny your application, they have to give you a written response that says, here's how you appeal. And they have to let a patient apply for financial assistance at the same time that they apply for Medicaid. So of course a hospital wants to make the person apply for Medicaid first and wait till the state gets back to them so that they can bill Medicaid instead of offering them financial assistance. Well, the law says that's not okay. The hospital has to let you submit your Medicaid application and your financial assistance application at the same time so that patients get some kind of certainty within 30 days. And then later, if you qualify for Medicaid, they have to figure that out on their own. So hospitals, as I said, are allowed to require you to apply for Medicaid. If you refuse to apply for Medicaid, they can give you a hard time. But if you apply for it, they have to let you do that at the same time. They are allowed to use credit scoring to establish your income. So instead of asking you to submit your pay stubs and your income taxes and things like that, they can use credit scoring, but they can only do it if it doesn't harm your patient's score. They're not allowed to require a Social Security number, and a lot of the applications have that on. They're not allowed to require that you submit a tax return or other IRS documentation. If you don't have it, they're supposed to let you come up with other ways to prove your income. They're not allowed to deny your application based on your credit score. They're not allowed to forward your account to collections while your application is pending. You're supposed to wait until they finish that application process before they do any collections activities. They're not allowed to consider your assets if your income's over 150% of poverty, and a lot of them are doing that. And they're not allowed to ask for information about the patient's monthly bills. They're not supposed to consider your bills when they figure out your income. It's supposed to be based just on your income. So they shouldn't be asking clients to come up with all kinds of crazy documentation about what their bills are. Billing and collection practices. So hospitals are allowed to hire collections agencies, but the agency that they hire has to follow the hospital's own financial assistance policy. They have to, if you qualify for financial assistance, they have to offer you an installment plan with low payments, and they have to charge a low interest rate that's set by the state. They have to train all of their staff, especially the staff who work in billings and collections, about the financial assistance policy. If you qualify, they can't force you to sell or foreclose your house, your primary residence. And they can't send you to collections while they're processing the application for financial assistance. And one part of that is that the application itself is supposed to tell the patient, while you're applying, ignore all the bills that you get. And sometimes the applications don't say that. But if somebody submitted their application, they shouldn't have to make any payments whatsoever while they're waiting for that response from the hospital. And finally, collections agencies, as well as the hospital, have to tell people about financial assistance. So even as they're sending out the collections notices, those notices are supposed to say, by the way, you might qualify for financial assistance. So we're going to talk about our website in a minute. So here are some advocacy tips. First, read the hospital's policy. So some hospitals have much better policies than the law requires, like the HHC hospitals in New York City. They go to a much higher income limit than the law requires. And sometimes the hospital's policy is much better than you expect. Sometimes it's much worse. So you want to read through the policy carefully. Make sure that they're not asking for things they're not allowed to ask for that are going to become barriers for your patient. And give us a call if it looks like there's something on there that they shouldn't be asking for. What if the bill isn't from a hospital? So sometimes people will get bills from the collection agency. Sometimes they'll get a notice that they're in court, that there's a lien. There's all kinds of crazy paperwork that people can get. And under the law, the hospital has to give you at least 90 days. So this is kind of the next two questions. So the hospital has to give the person at least 90 days to apply. So sometimes your client will come to you, they have a notice from a collection agency or from the court. It says they didn't pay a bill a year ago. And so you wonder, is it too late? It's not too late. Our advocates have had really good success taking these bills from, even if it's already gone to court, even if it's in collections, even if it's over the 90 days, taking these back to the hospital and saying this person should have qualified for financial assistance. You didn't tell them about it. You didn't screen them. How about if you make it right now? We've been able to get a lot of these bills taken care of, and people have qualified for financial assistance. So actually all three of these. What if it's not from the hospital? What if they missed the deadline? What if it went to collections? It doesn't matter what stage it's in. Even if it seems too late, check with us and give it a try. What if the bill is for a copay or a deductible? So that is not covered by the financial assistance law. The hospitals are only required to provide financial assistance for people who are uninsured or people who aren't covered for the service. Even so, talk to the hospital. They might have other funds that the hospital has that aren't state funds that they use to help people with copays and deductibles. So there might still be a chance that you can get some help with that. And does CHA have any materials that I can use? So we're going to go over the website right now that has all the materials that you can use. Also, actually not all of them are on our public website. So some of them are on the Advocates agency portal. The agency portal. So we have this amazing letter that a law graduate put together for us. And what it does is it goes through all of the requirements under the law and all of the common mistakes that hospitals make, like asking people for their Medicaid denial letter that they're not supposed to ask for. So what she did with this letter is she set out what she has in one letter, all of the possible problems that we've seen. She has a statement of the problem, like your hospital has asked people for a Medicaid denial letter. She has the law, what the law says and what the state said about the law, and then what your demand would be. So, the law says you're not allowed to ask for this. She cites to the law, and then it says you need to, change your policy and not ask our client for this letter. So what you do is you take this template letter, you find the sections that apply, you delete everything else, you put in your client's information, and you send it out. and it makes it really, really simple for you to appeal these really bad barriers that the hospitals are putting together. Okay. So then we have some other materials that are available to the public as well as to our advocates, and they're on the Community Health Advocates webpage. So as part of this report that Ashley talked about that we did, we sent letters to every hospital in the state that takes financial assistance, and we said, we want to see a copy of your application and a policy summary that you're required by the law to give to patients. So hospitals around the state, I think it's 168 out of 201, eventually gave us either their application or their policy summary or their formal policy. They gave us some sort of materials about financial assistance, and we put them all on the website here to make them available to people. So they're available under healthcare options and then help with hospital bills. If you click on that, you come to this page. Need help paying hospital bills. So we have a couple of different tools available for you on this page. The first is, what is financial assistance? Charity Care. We put together a one-pager that you can give to clients that explains what is financial assistance, how do you apply, what are the rules. It's pretty basic, and that's there. You can just print it out and give it to people. The second thing we have here is the current federal policy guidelines, and I think we're going to have to update this soon because it'll change. These are the 2011 policy guidelines. So we made it simple. People got people up to 100% of poverty get one level of assistance, up to 150%, up to 250, and 300. So we put in all of those guidelines for you. Every hospital application that we got has they're supposed to give you the guidelines. A lot of them have this chart, but a lot of them are from 2007, 2008. They're really outdated. So if you looked at that, you might think that your client didn't qualify. So make sure, no matter what the application says, make sure to come to our updated table and make sure that you've got the most current information. And then finally, we have the policy. So we have them in two places. We have this by county. So remember, the hospital has to provide financial assistance to anybody who's in their geographic service area. And that means the county that they're in and the counties that are around it. So many people have a hospital they like to go to, or and maybe your client's already gotten care at a hospital and it won't help them, but sometimes you know, the doctor has told somebody they need to have surgery, and they go to the hospital that they're used to going to, and that hospital gives them a runaround on financial assistance. Well, what you can do is, if they're, say, in Erie County, you can click on Erie County and look through this list of hospitals. See, there are plenty of hospitals in Erie County. If one hospital has given them a hard time and they're in a hurry, check through these other hospitals and see if one of them has a better policy, or if somebody knows that one of them does a better job of processing financial assistance. And then you can also look at all the counties around them. Maybe one of these other counties has a hospital that's willing to help them out with the financial assistance. So that's one way of accessing these policies. The other is going directly to the hospital's name. So we have this. We have them all listed by name. And we also have a search. Do we have a search? Well, anyway, you can just go down this. We don't have a search. But we have them all listed by name, and we have all of the aliases. So a lot of times people call hospitals by a lot of different names. Like I think New York Presbyterian in New York City, that's also called Cornell Whale, right? There's a lot of different names. People call them a lot of different names. So we've got them under all of the aliases that we could think of so that you can find the hospital that you're looking for. So I'm just scanning down to find one that I know we've got good information on. Let's look at Elmhurst Hospital. So we put up everything that the hospital gave us and said that we could put up. And you can see here. Oh, here we go. So we have different columns. General information is generally just a brochure they put out. A policy summary is sort of a more formal explanation of the hospital's policy that explains all the rules. The formal policy is what they give the staff at the hospital to use to make decisions. And some hospitals gave us that. And then the application is the form that the person would use to apply. And some hospitals gave us their materials in a lot of different languages. So Elmhurst has maybe 10 different languages, I think, so you can find it in each of the languages. And if you click on it, it'll bring up the materials that we have. So this is the HHC options brochure that explains how to apply. And as you can see, this has the income levels, but it'll need to be updated, so you'll need to check. But as I said, the HHC hospitals go way above 300% of poverty. They go up to, I think, 500% or more. So pretty much anybody who needs assistance can find some kind of assistance. And that's our website. Another one? Okay. Let's check another one. Okay. So we're going to check another to show you another hospital. This one's also in New York City. It's Lenox Hill Hospital. And they're now part of a hospital system as well. The North Shore at Long Island did. But they have general information, as it says, in multiple languages. If you look at this, they've got this is a big one. So they have this brochure that has just a little bit of information, but for a lot of different languages, so folks can find out how to get more information. And then here's their application. They have it in a lot of different languages, but this is the one in English. Okay. So as we can see, the North Shore hospitals are another hospital that go beyond what the law requires. They go up to 500% of poverty level. And they do a pretty good job. They have a lot of information. They see here, they tell you what the timeline is. You have 90 days to ask for this application and 20 days to finish it. They tell you about all of their rules. They tell you where to send it. They do say here, once we get your completed application, you can ignore all the bills until you hear from us about your application. And see here on the first line, it says Social Security number optional. That's great that they tell you that you don't have to include it. And they ask for some more information. They're asking for income, which they're allowed to do. You just have to fill it in. And they're giving you a lot of different ways in that little box. Provide copies of checks, pay stubs, or statements to support your income. They're not saying that you have to have a tax return. So this is actually a pretty good and pretty simple application.
I also think it's really cool on these pages. It tells you how much the hospital got to fund their charity care program at their hospital, which I always find very compelling.
Yeah, so those are 2010. Those are the latest numbers that we have. Actually, so this is Eastern Niagara Hospital. They gave us, we have a copy of their charity care policy, but they said they didn't want us to post it, which is a shame, but they're pretty firm on that. So that's how it is. And you can see this one. We've got the different aliases. It used to be Lockport Memorial Hospital, and now it's part of a larger, it's merged with another hospital, so it has another title, Eastern Niagara. So we've got both in the listing if people aren't sure which name they're looking for.
Is it possible to show them the letter, or is it we have to log into the portal, right? Can you show them the letter that Carrie's talking about?
Mm-hmm. These are different questions.
Mm-hmm. We're going to try to log in and show you that letter that Carrie was talking about. That a lot of we didn't show you one here, but a lot of these policies, when you look through them, you're going to be confused. You're going to say, wait a minute, Carrie said that they can't do this. This policy is asking for stuff that they can't ask for. What am I supposed to do? And so, as Carrie said, there's a letter that we worked on here that we posted for you guys to use that that you can use and send to the hospital to say, hey, you can't ask for that stuff. You need to help my client process the charity care application without asking for all these extra things. So Catherine's going through here, and she's going to bring it up for you. And I really want to stress, use these materials, use everything, and tell us if there's something that you could really use in your effort to help your clients get charity care, and we'll try to create it. we know materials can be really helpful, and we want to help you guys.
So we put together this letter, and we had a lawyer do it so it looks nice and scary, and hopefully when the hospitals get it, they'll see that we're very, very serious about this. And she tried to make it as user-friendly as possible. So you can see the things that are in like bright pink are there to call your attention. Either if it's in bolded, it's someplace for you to fill something in, like to talk about. So if you go back to so let's look through here. We've got insert the name of the hospital, list the problems. Just give a quick summary of the problems that your your client is seeing. And then down in this paragraph it says your hospital received. You can go to the website that we just showed you, and it says how much each of the hospitals received from the financial assistance pool. So you can add that to make it a little more serious, remind them that they owe patients this kind of help. And then on the second page, here we've got the place for you to include the barriers that your patient is encountering. And then as you look down here, each of these paragraphs, starting with the hospital policy is not available to the public, describes one of the problems that we see pretty commonly. So in this case, it says the hospital policy is not available to the public, is excessively complex, or does not contain the required information. So she's written out here all of the requirements in the law, what the law says that hospitals have to do, and then after that you can fill in, here's what my client experienced. You know, she went to the emergency room and no one told her that there was financial assistance, and now she's getting bills, and it's your job to make sure that we can have a copy of this financial assistance policy. Or the policy that she gave us didn't include any information, so she didn't know how to fill it out. So each of these paragraphs is similar. The hospital sends people who are eligible for financial assistance to a collection agency without telling them about financial assistance. And some of these seem kind of duplicative, but in a way it's just a way to show the hospital how very serious the errors that they've made have been. They violated a lot of different rules that the state has for this, and we need them to get serious about doing a good job of this. So in each of these places you can just, if this paragraph applies to your patient, to your client, then you include it. If not, just delete it, and then give some information about the specific experience that your patient had. And then at the end, there's a paragraph that says, I'll be calling you to discuss how we can process the client's name's application. If you wish to contact me, I can be reached at that number. If you want to, at this point, you can also say what you want for your patient. Like, we want you to send us a copy of the application. We want you to help us fill this out, whatever. And then CC, we have pre-amend, and we'll have to change that. But we'd like you to send us a copy of this. So partly because we want them to see that you're sending it to somebody else and that it's very serious and they need to deal with this, but also because we're trying to track this. We're trying to figure out which hospitals are doing a good job and which hospitals are doing a bad job so that we can talk to the state and make sure that they get involved. So this is, we're kind of at a moment right now when we have an opportunity to make this system work much better for patients. Because in the Medicaid redesign team, in the recent group that worked on recommendations for Medicaid redesign, several of them recommended that the system should be changed so that it works better for patients. And the Affordable Care Act is also going to cut the amount of money available to states for this. So the states are all kind of trying to figure out how to do a better job of giving out this money so they qualify for more federal money. So we have a chance right now to give the state information about what hospitals are doing, whether they're doing a good job, and how we think they could do a better job. So the more we hear from you about what your patients' experiences are, the better job we can do changing the system. And we're also about to release this report, and reporters are going to want to talk to people who've had this experience. So if you have anybody at all who's having trouble getting financial assistance and would be willing to talk to a reporter, we're still looking, please let them know. And now I see that we have a bunch of questions.
So I think what we're going to do for the questions, thank you guys so much for typing them in. We're going to start by addressing the questions that have been typed in. We're going to read them out to you guys, and then Carrie will try to answer them. And then we'll try to open up the phone lines. We've had some trouble doing that in the past, so I'm not sure if it's going to be possible. So if you can, if you have a question, go ahead and type it. We'll try to unmute everyone, but I can't make promises. So let's get started with the questions. So the first question says, it's from Greg. Hi, Greg. It says, if a client has Medicaid and exhausts the 20-visit limit for physical, speech, and occupational therapy, may they ask the hospital for a sliding fee scale for visits over that limit?
Absolutely, yes, Greg. This is the kind of situation where somebody has insurance, but their insurance doesn't cover the benefits that they need. So they're basically uninsured for this benefit, and yes, and if they have Medicaid, it's pretty clear that their income is going to qualify them for financial assistance. So they should definitely ask for that.
Okay, next question. How does credit scoring help verify income? If someone has a low score due to their debt, what is the potential effect on financial assistance application? Another question from Greg.
Sure. So how does credit scoring help verifying income? Instead of asking the patient to bring in a big stack of their pay stubs, or sometimes you have to bring in all of your bank statements, whatever ways they have of asking for it. One thing that I guess hospitals do now is sometimes they have access to this credit scoring, so they just take your Social Security number and your name and put it in, and then they get a report of what your income was for the last year or whatever, and that's how they verify your income. But they're not allowed to use your score to determine whether you qualify for financial assistance. So it shouldn't have any effect on their financial assistance application. And they're not allowed to do it if it brings down your score. You know, sometimes if you get your credit record pulled a certain number of times, it lowers your score, so they're not allowed to do that.
Next question from Hisu. Is there a standardized guideline regarding the amount that a hospital can collect each time when payment options are set? I think it sounds like maybe Hisu's asking about like the sliding fee scale.
No, I think she probably means the payment option. So say you qualify for financial assistance, but your income's kind of higher, and you still owe the hospital like $5,000 or something because you had a really big procedure that was really expensive. You got some financial assistance, but you still have to owe them. They have to offer you a payment plan. And I believe that the limit is 10% of your monthly income, but we can verify that. So there is a limit to how much they can ask you for every month, and there's also a limit to how much interest they can charge you for that.
Cool. Next question from Michelle. Typically, you are given 3 months from the date to apply for Medicaid or charity care. What can we do for patients who come to us with bills from 6 months ago, but were never given any information about charity care from the hospital?
So this, you are given 90 days, but as I said before, a lot of times we've had patients come, they didn't hear about financial assistance, they've got bills, maybe they're in collections, it's been a really long time. I think Stacy just scored a really big victory, right? She had a patient, or she had a client who came to her, and I think he'd been to the emergency room a year before. And the bills had already gone to collections, right? Where they were trying to like garnish his income, like it had gone really, really far. And she went back to the hospital and said, you didn't do a good job, you didn't tell him about financial assistance, he obviously qualified. And they pulled it back, and I think he had to pay $20 or something, right? Yeah. So if you have one of these cases and you're nervous about it, give us a call. Sam's done a bunch of these, Stacy's done them, they can give you some advice about how to approach it.
Yeah, so it really might still be possible to get some traction there. All right, next question is from Alexandra. What about anesthesiologists or other doctors that are not directly on hospital staff? I think what she's asking is, does hospital financial assistance apply to doctors' bills?
Thank you, Alexandra. I almost forgot to talk about that. This is a big problem that people have. You're right. So the hospital financial assistance policy qualifies to the hospital and any bills that come from the hospital, but a lot of times there are people who work for the hospital who don't actually work for the hospital. Like you said, an anesthesiologist, there are other doctors that don't work for the hospital staff, and so you might get bills from them, and they're not required to follow the financial assistance policy. They're encouraged to, but they're not under the law, and so if your patient is going in to have something, they should try to ask some questions ahead of time and make sure that everybody who's going to be seeing them is part of the hospital staff.
Thanks, Alexandra. All right, next question is from Alicia. Wouldn't an uninsured applicant qualify for financial assistance as well?
Underinsured.
Oh, underinsured. Sorry, Alicia. Let me ask the question again. So the question is, wouldn't an underinsured applicant qualify for financial assistance as well?
So it depends how they're underinsured. When people say underinsured, there are kind of two different things. One kind of underinsurance is when their benefit stops, like they have an annual limit, like we said, or they're only covered for 10 visits. Or once you're not covered for that benefit, you're underinsured and you qualify for financial assistance. Sometimes when people say underinsured, they mean you've got really bad insurance that has really high deductibles or co-pays or co-insurance. And in that case, financial assistance, the hospital isn't required to give you financial assistance for that. But a lot of hospitals do, like the HHC hospitals do give people help with that.
Got another question from Alicia here. Are assets considered for patients with incomes below 150% of federal poverty level?
So this is a really bizarre part of the law. When they first passed this financial assistance law in 2006, at that time Medicaid looked at people's assets up to 150% of poverty. So the hospital said, to make it simple for us and to make it all fair, we should look at people's assets if they're below 150% of poverty. And they won that. So the law says, in a really counterintuitive way, that if you're under 150% of poverty, they can look at your assets, but they can't look at your assets if you're over 150% of poverty. And this is a weird rule that makes sense to no one. The hospitals get it wrong all the time. They think they're supposed to look if you're above 150% of poverty because that makes sense, right? No. You're only allowed to look at assets under 150% of poverty. This is one of those things about the law that we want to try and get rid of. So be really careful. And a lot of applications, they make every single person submit information about their assets. They ask everybody to submit their bank account statements, stuff about their house, like stuff that's really, although they're not allowed to look at your house. No, so they'll ask people for information about their bank accounts and other assets. And it can be really burdensome. And if they're not even allowed to look at that, why should you have to submit that? So that's one of those things to tell us about if you have a hospital that's giving somebody a hard time about that. And I think we skipped one. What if a hospital in our county requires all the things that are not allowed? Call me. Please call me. I want to know. I want to work on that with you to get that hospital to change their policy. So give us a call right away.
Okay. Next question. If a client's bill has gone to collections, does the client still have the same protections under the Federal Fair Debt Collections Act as a credit consumer would? Ooh, this is a tricky one.
The Financial Assistance Law doesn't have any impact, I don't think, on the Fair Debt Collections Act. So if the collection agency is being abusive and violating that law, regardless of whether they qualify for financial assistance or not, that law would definitely apply. But this law gives people additional protection.
Cool. Thanks, Amanda. Got another one from Hisu here. I might have got it incorrect, but based on the sliding fee scale table included in the presentation, only households that are under 300% of federal poverty can apply for financial assistance and charity care, right? Or does the sliding fee schedule differ by hospital? I know that Westchester Medical Center accepts households up to 500%.
So that's right. The state law is a floor. It's not a ceiling. So a lot of hospitals offer financial assistance to people above 300%. The law only says you absolutely have to, if you take this money, you have no choice but to give financial assistance to people up to 300%. But you're allowed to go as high as you want. So there are hospitals in a lot of places that go up to 500%, or say that they do.
We're trying to bring up this slide just so you guys can look at it. That one. Yeah. Okay, next question is from Alicia. What if a client paid an outstanding bill and then later found out that they qualified for charity care? Would they be entitled to a refund?
I guess they would. We haven't had that happen, so we'd have to figure out how to make that work, but I believe they should. Have we had anybody get a refund yet?
I haven't had a case like that.
But yeah, if that happens, give us a call and we'll see what we can do, because they should get that.
Thanks, Alicia. The next question is from Betsy. I see that Wayne County had no hospitals listed. Does that mean that the hospitals in Wayne County were unwilling to share the charity care info with CSS?
There should be a hospital in Wayne County. We'll have to look at the website and make sure, because I think there is a hospital in Wayne County, right? And even if they didn't give us their information, we put them on the website. We put their hospital on the website and said this hospital declined to share their information with us, or this hospital asked us not to post their information. So we will have to look into that.
So we're trying to go there now by county.
Oh yeah, there's something. Let's look at the list because there's a hospital list called Wayne County, right? So maybe we just didn't like it. No, we're going to have to fix that. I look for it.
Thanks for pointing that out to us, Betsy. We'll take a look and try to figure out if we just didn't receive a policy from them or if we just forgot to list them. And if there's a hospital you have in mind that you have clients who've used, shoot us an email. We'll see. We can look through our records to see if we have something from that hospital.
And also, if you get a policy that you don't see on our website, let us know, and we'll see if we can work with the hospital to post it.
Yeah, that's great advice too. Just to let everyone know, we're having some trouble unmuting people. So we're not going to be able to unmute everyone so that they can ask questions of Carrie in real time. So if you can keep typing in your questions, that will work best for us. So we will keep going. We've got a couple questions from Mitali. Hi, Mitali. Could you talk about ambulance bills? Are they covered by hospital financial assistance?
So it depends, again, if the ambulance is owned by the hospital and part of the hospital services or if it's independent. I know that in New York City, there is financial assistance. I know Becca from Make the Roads been working on the fire department. The New York Fire Department has a financial assistance policy for their ambulances, and it's been really hard to work with them on that in some cases. But there might be some financial assistance that covers ambulances, but it's not part of this law.
Okay, thanks, Mitali. Got a question here from Amanda. Is there a dental aspect to the charity care law?
So the financial assistance policy that we're talking about here only applies to hospitals. So if your client was in the hospital and they received the dental care in the hospital, then it would be covered. There are other programs that provide this kind of federal and state money to clinics and diagnostic centers and other providers. So there might be different sources for dental care outside of this, but that's outside. But what we're talking about here is just hospital care, and I don't know about the dental. Yeah.
Becca just typed into us that the FDNY does have a charity care policy, but she notes it's very hard to access. So she invites that if anyone has trouble accessing it, that they can give Becca a call, and you can look her up in your directory of agencies. So it looks like there aren't any more questions. I can give you guys a minute or two to come up with some questions if you'd like. As Carrie said, this has really been a passion of hers, chasing after hospitals who aren't doing the right thing and not having charity care policies that are compliant. So definitely let us know if you have cases that your clients aren't able to access charity care, or where you read the policy and you think, whoa, this is not compliant with the law. Definitely use the letter that we created. Please use our website. You can't imagine how many intern hours went into that, collecting all of those charity care policies. We really want you to use them. Use it to print out the application. Use it to print out the policy for your client. And let us know if there's some kind of material that you need or wish that you had. Let us know, and we'll try to create something for you to better assist you in helping your clients. So it doesn't look like there's any additional questions. If you do have additional questions for Carrie, feel free to email me and Leon, and we'll get those questions over to Carrie, and she can try to answer them. And we are going to move on. Thank you so much, Carrie, for coming to present with us this morning. So our next presentation is from Catherine Chow from here at CSS also. Hi, everyone. Catherine's going to be presenting on the story bank. You hear about the story bank from us all the time, I know, but we thought that maybe we should tell you why we're always bothering you about story banks, because I know how annoying it is. I swear I know. I was case handler for a really long time, and all of a sudden people would be in my office demanding stories from me, and it puts you in a sort of weird situation with your client. You want to help them. You don't want to ask them for things, but your boss is yelling at you to give you a story. So we wanted to just take a moment to explain why stories are so important and why we're always nagging you for stories. And Catherine is going to take some time to explain, the power of your stories and the power of our work. And she's going to tell you a little bit about how to get stories to us. So take it away, Catherine.
Great. Thank you, Ashley. So as Ashley said, I'll be talking about the power of story. So stories give a face to the issue and a voice to the communities we serve. We hope that they're able to invoke emotion and empathy, as well as hopefully spark motivation and some sort of action in our readers. Now, what's the purpose of story collection? Well, stories bring awareness to the CHA program and healthcare issues and trends. They also demonstrate the positive and/or negative impact of healthcare and legislative policies. And they act as an advocacy tool to push forward better healthcare and health outcomes. But last, definitely not least, they convey the real impact of CHA services to our funders. Now, we have a lot of different target audiences, and it kind of depends on the publication that we're working on for how we want to set the tone for the publication to our audience. But these are the four main target audiences that we have. We have legislators who, through our stories, can better understand their constituents and their community's needs. We have funders and other stakeholders who can see the true impact of the funding that they provide. We also have media who often come to us seeking clients that can help augment their stories. If you guys may have seen in your email inboxes in the past couple of weeks, we've been looking for charity care stories and surprise billing stories. So I'm going to make a little plug that if you have anyone who can fit those two topics, please contact me. And we also have general public and potential clients who are our target audiences. And this is usually through media that we're able to reach this demographic. But what we're really trying to get at with this audience is to let them know that they can contact CHA for assistance. So where are our stories used? They're used in organizational materials. As you can see on the right-hand side, we have our Health Reform Works booklet, which many of our CHA clients were profiled to talk about to show how the Affordable Care Act benefited them. We also have media stories, as I explained before, and to the left-hand side of the slide, we have a photo of one of our CHA clients, Alan Evans, who was profiled in the newspaper by discussing how his insurance raises premium more than 75%, and how a lot of insurances are just arbitrarily, it seems, increasing premiums without giving any sort of justification. And then we have legislative handouts. Now, the most important part about story collection is identifying a great story. A good story allows the reader to connect to the client's experience in a meaningful and motivational way. But people often forget that stories don't have to have a positive ending to make readers feel good. Sometimes stories that incorporate some sort of injustice or ongoing issues that make a reader feel frustrated or angered actually will help motivate them to a call to action. So we don't need stories that have a happy ending. When you're selecting a story, you want to take a look at the following elements here. The more elements that you include in a story, the more effective and stronger it can be. Now, the most important aspect of a story is emotional impact. Things like extreme situations, debilitating illnesses, or difficult family circumstances, these are all very unfortunate, but these type of events have more of an effect on a reader. They emphasize a wide range of needs, and they also show the great impact that healthcare has on people. Stories can also address important and current legislative and healthcare issues because they help advocate for changes and show the importance of legislation that need to be passed and or sustained. Stories that have a common or trend
issue, emphasize problems that many people deal with all the time or that continuously pop up, we see. Financial impact. We often have clients coming to CHA needing help resolving some sort of financial situation or a bill that they have with the hospital, prescriptions, premiums, because oftentimes the money that they owe is so extremely difficult for the client to pay. We see clients having to be faced either sacrificing other essential expenses like paying for their apartment or their house, or not paying for food in order to pay for health care. So these are all great elements to include, as well as finding clear and articulate clients. This would be really important for media referrals. We want to make sure that our clients are able to concisely and be willing to share their story, especially for media referrals. And this kind of goes without saying. They need to have a positive relationship with CHA and aligns with CHA goals. Now, I just talked about the most important part of story collection, but now I'm going to talk about the hardest part about it. Client about sharing their story. So the best person to contact a client is the one that has the most trusting relationship. They're the ones that the client feels most comfortable speaking to. And this typically tends to be the case handler who over time works with the client on their situation and develops that trust. These case handlers can help address any sort of misconceptions or concerns that a client may have. And when you're approaching a client about a story, you want to make sure, well, timing is everything, and that if you can, contact the client after their case has been or is on track to be resolved. You should also be very sensitive to the client's situation. For example, if a client is still going through some sort of cancer treatment or still recovering from a surgery, it may be best to wait until they're done recovering before you contact them about their story. Now, you also want to explain to them where their story will appear and how it will be used. And if you can, ask the client in person or through the client's preferred communication channel. You want to discuss what the interview will entail and where it will take place. So for example, when CSS conducts interviews, we typically do them over the phone, and they usually last about half an hour. But if there's a media interview, that tends to be at the client's office or at their home, and that can last for a greater amount of time. Now, why should a client share their story? Well, you want to explain the benefits from the client's perspective. You want to emphasize the importance of them sharing their own story and why it should be told. So, for example, their story is a great example of what many New Yorkers are currently struggling with. They emphasize the need for child services or legislation in order to prevent the same thing from happening to others. And it's also, their story is a great empowering tool for them and allows them to be part of a larger movement to help push for better changes among the healthcare system. Now here's an example of how to approach a client. I'm not going to read it out, but you can see it will sort of offer a framework for you whenever you're talking to a client later on of how to frame things and incorporate what I just talked about in the previous slide. Here's some things to keep in mind when you're talking to a client about sharing their story. You want to make sure that, of course, you always respect the client's decision. You don't want to make them feel guilty or as if they owe you because you helped them in the past with their situation. You want to also make sure that the client feels comfortable, and you can also offer to be present during the interview. And you want to let them know that they don't have to answer any questions or any sort of information that they don't want to. You want to be flexible and try to accommodate the client's requests. And oftentimes, many of you have come across this where a client is very hesitant to want to give their full name or have their photo taken. And what we suggest is, unless the story is very strong, we require a full name. But if the story is really great and we really want to incorporate it into a publication, we may be willing to anonymize their name or give the client permission or the opportunity to review the story once it's written. But we really want to avoid any sort of anonymizing or opportunities for review because, first of all, anonymizing it really just kind of
the story loses its strength. But if we do decide that it's a great story, please talk with us, and then we can decide the best approach to getting the story. Now, what do you do when you find a great story? Well, you send all the information in this blue box to me by email. You want to also make sure that you have a summary about the story that includes the issue, whether or not the client had insurance, and if yes, what kind, the type of services that you provided, and the resolution, if there is one. If there's anything else that you feel would be really important to the story to help make it stronger, please include that as well. You want to be prepared for any follow-up questions about the story. And then also, don't forget to check the story bank box in the database. Now, when you have a great story and you're submitting them to us, please try to get the client to sign a release form, because we may have an amazing story, but without a release form, we can't use it. This release form helps protect CHA and our organizations from any possible lawsuits in the future. And that's it. So if you have any questions, feel free to type them in right now, or you can send them to me at cchow@cssny.org. Thanks, everyone.
I'm going to ask a question, Catherine. Something you said in your slide is that agencies should give anything else that might be pertinent to make the story stronger. Can you talk about some things that you're thinking of here? What types of information make a story stronger other than client came in, uninsured, went to hospital, got charity care? What other pieces, what's going to help you craft a beautiful, really strong story? What kinds of information are you looking for there?
And I think that goes back to one of my earlier slides that I'll bring up real quick about what makes the story so great and what elements to include. So I think when you're asking me that, I think emotional impact. So how did CHA help them, or how did the healthcare issue affect them so deeply? So I think if you hit some of the top 4 points and explain, how was it emotionally impactful for the client, or how did the bill affect them so greatly, I think that's really important to send that along to me, because that doesn't, when you're talking about their full name, how many children they have, their household income, that doesn't come along. So any other information that really shows the effect of the issue is what I'm looking for.
And I also think I would add to that list, include things that give the story color, include things that are unique about the client. Maybe they're a small business owner. Maybe they're a farmer. Maybe they have some other kind of job that's not common. Maybe they're like a steel worker or something. These little pieces of information that don't sound really important, they really start to give a story a lot of color. So maybe it's a family that has a same-sex marriage, or maybe really to start personalizing it, make it speak, make it about real people, not just in the database it's about just numbers and clients and data, but the story is really about a person. So really trying to make it relatable. Any other questions? Please chat them in. Right now we don't see any, but I'll give a couple minutes, or a minute for you to chat it in. Okay, so we have one from Becca. Every time we check the story bank box, do you want us to send you the story or wait for you to contact us to send the story? If you can send us a story with all the information, that'll be best. We look at the story bank box every once in a while, but I think especially for more urgent situations or media requests, it'd be a lot easier for us to have that information on hand about the client and their summary of their story. So just to give you a little background on what Catherine's saying here, we use the database to, basically check off, did you submit a story for your deliverables? So when you think database, you're thinking deliverables. And Leon is checking that every single month, every single quarter to make sure that everyone's getting their stories in. Catherine is trying to develop truly a bank of stories. The idea being that when the New York Times calls us and says, hey, do you have a story by 5 o'clock today that we can tell something great about your program, that we can just dip into this bank and have these great, colorful stories that represent the clients that the entire network serves, to show the diversity of our program, to show the importance of our program, and that we can really turn it around on a dime so that we can get the message out to these big publications, because that's really important for sustaining our program, to keeping CHA around as a resource for our clients, and keeping us all having jobs. We have to keep making the case that our services are really needed and that we're doing a good job. So I think the answer is, when possible, send it to Catherine right away. That way we don't actually have to come back and pester you about it later down the road.
And that's why also that the release form is so key, because we will not give any case information or stories to media requests unless we have the release form and that the client is willing to talk to media. So if you can, along with the information, give me the release form as well. I understand sometimes it's difficult, and I can do that as well when I'm writing up the story, but if it can come along with the rest of the information, that'd be best.
You know, this is a two-way street. If you are submitting stories to us and we're developing this story bank, maybe the day comes that your executive director needs to go to a big meeting with some big shot, and you need a story, that you want something, that you want data, that you want a client photo to take something along with you, that you want one of the one-pagers that gives a really compelling, really colorful story about the work that we do. We can help you with that. We can get the data for you. We can create the materials for you. That's what we want to do. We want to help. We want this to be a two-way street. It's not just about you guys giving us stories so we can write them up somewhere. It's about really building something. So always remember that. And if you ever have need of materials like that, something that shows the work that we do for your own purposes, to get your own funding for your agency, let us know, and we can try to work with you to get you something. Great. Well, thank you so much, Catherine, for coming to present on this today. Last but not least, we have Nora Chavez. She's going to be presenting on a tricky policy. We sent it around yesterday about doing appeals and how that plays with our funding this year. This is going to be a little bit of a change for our agencies that have been with us for a while, and for the agencies that were with us last grant year. This is a change from how we used to do things. So really listen up here. This is super important, and I'm going to let Nora take it away.
Yeah. Okay, so hello everyone, and yeah, as Ashley said, I'm going to talk about something that is new to the CHA agencies that were with us before, but something that applies to everyone, to all the CHA advocates, and it's something that we mentioned during the intensive training, and is that we cannot handle appeals, and that's the message here. It's very important because this has implications for our funding and our reporting. So as Ashley said, we sent you guys a draft yesterday of a memo that we wrote outlining the implications of this and how to handle these types of issues. And we're going to send you the final version today. And this presentation is to clarify what do we mean by what do we mean by not handling appeals, and how do we then what do we do with cases that relate to appeals. So let me just start by defining during this presentation I'm going to be talking about appeal-related cases, and by that I mean cases where clients have appeal rights or have the right to complain, to file a grievance, to file an appeal, or to ask for a fair hearing as a way to resolve a problem. So when I talk about appeal-related cases, that's what I mean, those types of cases. Some of them we cannot, some of them we are not going to be able to count towards CHA, and we are not funded to do, Some of them we are. So first, I'm going to talk about the. I'm going to present how these restriction relates to our funding. What exactly are those restrictions? What to do if we have clients who need assistance with appeals, and how to enter information about appeal-related cases into the database.
And guys, you know, we have Nora here today. She's going to be able to really clearly explain this policy, and I know it's going to be a little weird, so just bear with us. And if you have questions, please ask them. Go ahead and chat them in, and we'll address every question that you ask us. So chat them in as you think of them, okay?
Okay. So CHA services are now funded through the Level 1 Exchange Establishment Grant. This is money that New York State receives from the Health and Human Services, from HHS, to plan and begin to implement an insurance exchange. The fact that this is for exchange, it's an exchange establishment grant, means that all the services that we are funding to provide have to be services integral to the design of the exchange. Okay? What do we mean by that? This means that mostly all of the services that we have traditionally provided through CHA are related to the exchange. For example, helping people enroll in health insurance, helping people access health care, telling them how their insurance works, helping them understand their medical bills. All of those traditional CHA services are still counted, are still okay, and are still accepted as integral to the exchange, and there's no problem with those types of services. So what are the restrictions? The restrictions are really for handling appealing cases. So funding for this grant period cannot be used to handle complaints, appeals, or fair hearings. And what do we mean by handling? Okay? What we mean by handling is counseling a person about the validity or the merits of a complaint, appeal, a fair hearing, advising them on whether to file it or not, filing the complaint on their behalf, or representing the consumer on the complaint or appeal or fair hearing. So anything, although these restrictions, as you see, this restriction impedes CHA advocates to provide, it doesn't impede CHA advocates to provide basic information about appeal rights. So although we cannot advise or represent, we can educate consumers about their appeal rights. Okay, we can provide general information, but we cannot go beyond that point. This restriction is in the state's contract with the Health and Human Services. It is in CSS contract with the state, and you also have it as I think it is an appendix to your subcontract with CSS. So it's all over the place, and so we have to be careful about it. So since we cannot handle appeals using this CHA funding under this grant, we know that the clients that need assistance with appeals are not going to disappear. So we really want to encourage those of you who have other kind of resources in your agency who want to handle those appeals using additional funding to do so. Now, if you don't have those additional sources, that's what I'm going to talk about now. It's like, what do we do if a client needs help with appeals? So CSS is going to be handling appeals using non-CHA funds. So whenever you help a client, whenever you have a client who needs assistance with handling with their appeal, representation, or advice, you can refer those clients to CSS, and we will use non-CHA funds to help them. So how do you refer a client to CSS? We wrote this list. It's a very detailed list because it includes the steps that you should follow in order to first get some credit for the basic orientation that you provide your client, and second, secure a proper referral to CSS and reduce the back and forth between you and CSS. So these are the steps. First, give the client information about his or her rights. This general information would include the deadlines, helping them understand, for example, if they show up with an adverse determination, helping them understand what the adverse determination said, what is the deadline to file, what are the rights to get aid to continue, for example. So give them clients that basic information. Then give them any advocate for yourself materials. What I mean by these are some templates that CSS has created that are on the portal that you can access to the portal. We're going to send you exactly some instructions about where exactly in the portal it is. So as we see that this is limiting the scope of work that CHA advocates can do, we still want to respond to that by creating materials that people can use. So far we have templates for denial for out of network emergency care, for denials of or based on medical necessity. We have template letters for negotiating deals with providers, and those are letters that you can give your clients and that would be counted as providing general information and would not put our funding in jeopardy because it's considered basic orientation. So after you give the client this basic information about the rights and you provide any appropriate materials that CSS materials, then you can close the case in the database. After that, you should obtain a verbal authorization from the client to refer the case, and explain to the client that CHA or someone from CSS will contact them within 5 business days. It is important to explain that the referral does not guarantee that CSS will handle the appeal, because what we will do is another assessment. We will do an assessment of the case and decide if the client still has the possibility to appeal or not, if there are grounds for the appeal or not. So please explain to the client that they are going to be referred for further assessment, for further assistance, but not necessarily they will be guaranteed a representation. The way to do this is by emailing Leon with the case ID, the CHA case ID, your rationale for the referral, and all available documents relevant to the case. So this will include HIPAA releases, adverse determinations, or Medicaid denial notices, things like that. Now, how do we enter those cases into the database? For appeal-related cases, any of the needs that are listed in your screen may apply. So you still can use the traditional needs: help, complaining, appealing, service denial. That's need 4.6. 4.7 needs help with coverage denial, or 4.8 needs help with recertification denial, depending on the case. The outcome for these cases should be coded. We have added a new outcome, and the new outcome is provided general information and materials on rights. And this is the outcome that you should use for any appeal-related cases that you handle under CHA. Be very careful about this, because if you select any other outcome, your case is not going to be counted. I'm going to repeat that. For any appeal-related cases that your agency handles under CHA, you can select any of the needs that are listed in the screen, but the outcome that you should always select is provided general information on materials on rights, because that's the only scope of services that we are allowed to conduct for people who need help with appeals. Now, if you refer the case to CSS, then besides selecting that outcome as the outcome for your case that you provided information, you should select, you should check under the service session information. You should select make referral, that little box, and then when you select that box, the option Community Service Society will pop up, will show up. So you should select that you made a referral under the service session, and that CSS was the agency that you referred the client to. Besides this, any other needs that are relevant to the case should be included. So, for example, if besides the appeal-related case or the appeal-related need, the client also needs additional coverage, of course, you should also include all of those needs as part of your case. So that's basically it. you're going to get the memo this afternoon. You're going to get this afternoon or tomorrow. Ashley and Leon will send it. And now we're all going to open to see what questions you have so far.
Okay, I'm going to read our first question. It's from Greg. Could I say something like, the plan denied a service you requested, you have the right to appeal or a fair hearing if you decide to do so. I can't advise you on the appeal, but if you want help, I can refer you to CSS or to another CHA.
Mm-hmm. Yeah, I think that that's totally appropriate, and then you will get credit for provided basic information to this client relating to their appeal, and you will not be in trouble. We will not be in trouble. Yeah.
Yeah, and to just reiterate something that Nora said, we know that some of you will, do routinely handle appeals. It's not that we're saying that you can't do that. We're saying that you can't use CHA funding to handle someone's appeal, and that we can't give you credit under the CHA grant for handling an appeal. So if you're in a situation where you have decided that you really want to go forward with an appeal, especially for some of our agencies who've been around a while and been handling appeals, we're not saying don't do it. We're saying that you have to use other funding. And if that's not a possibility that for your agency, then refer it over to us, refer it to CSS. We do have other funding that we can use to handle these appeals.
Yeah. And if you decide to handle the case, if your agency has a different funds to handle those appeals, that's great. But we don't put that into the database.
Right, and that has to do, like Nora said, with our contract, with the state's contract with Health and Human Services, and then with our contract with the state. We just have to be careful to work within the confines of all of these contracts that are floating around. There's another question here from Kathleen. Where can we access this presentation? So Kathleen, we're going to post this presentation on the agency portal by the end of the day. And just so everyone knows, we actually have recorded all 3 presentations today. So if someone in your agency wasn't able to make it today, they'll be able to not only look at the presentation, but also view the webinar as well. And we'll try to get that recording up as soon as possible by the end of the week, hopefully.
And then just for your reference, it's better to use the memo that we're going to send, because I use this presentation, the content of this presentation is nothing less than what is in the memo.
Yeah, so print it out, post it on your wall, whatever you have to do. And of course, ask us questions. We know that this isn't the simplest thing, so feel free to ask us questions. You can reach out to me and Leon. If me and Leon don't know the answer, we will ask Nora, and we'll get the answer for you. Mm-hmm. I don't see any other questions at the moment, so I think we will end here. Thank you guys so much for coming to the webinar today. Like I said, we recorded everything. We'll post that on the portal, and let us know if you have questions, okay? Thanks so much.